Okay, welcome everybody. Today is April 25th, 2020. This call is being recorded. This is a conference call with patients at Coalinga State Hospital and two reporters from the Associated Press, Robin McDowell and Mike Rezendes. My name is Jeff Gambord, a patient at Coalinga and the moderator. The topic today is singularly focused on COVID-19 and specifically staff within the Department of State hospitals not wearing masks properly. And today we are focused on Coalinga State Hospital as one of those facilities. In addition, how patients view this issue and their essentials workers here at Coalinga. Robin and Mike have a very tight schedule, and it was a matter of luck that they have given us approximately 30 minutes, maybe 40 if they have some questions and they're intrigued by some of the comments from our patient presenters. And we have, I believe, 9 currently on the line. One is not currently present. There is a possibility in the future that the Associated Press may consider other systemic statewide issues, which I have presented to Robin McDowell in several emails and phone calls. I want all of you to understand that they have made no commitments at this point in terms of writing a story. So Robin McDowell and Mike Rezendes, here we go. Men will give approximately 2-minute presentations about observing large numbers of police and staff not wearing masks inside this facility, violating the governor's social distancing order with 4-digit codes, not identifying themselves or their units, fearing retaliation of some sort. Our first presenter will be Sam, who will be identified because he has been on a hunger strike and refusing medication for 10 days as of today, and is a 68-year-old cardiac patient. To those who may be listening to this recorded conference, I will be providing Robin and Mike a decoded list of who these presenters are, which they may provide to any credible investigators who wish to validate that these presenters are real and wish to investigate the claims that are being made here, providing that their identities will be protected. What is so insidious and alarming here is that the people to blame for this is, in fact, the upper management of the Department of State hospitals, not the staff who are not wearing their masks. As I've shared with Robin, this is happening not only at Coalinga, but other hospitals. And I won't be any more specific in how I've validated that. Many people are aware that I have sources of information in terms of staff and other means. Staff not wearing masks properly and not socially distancing. It's alarming. Many of these staff that work in these facilities today are young, 19, 20, 23, in that age range. As many are aware, they think they're Superman. They think they're invulnerable. Some of the things that I've discovered, they don't even watch the news. I've had staff specifically tell me that the corona, you guys make too much out of it. I mean, it's very alarming. I run 8 websites. For years, we have all been complaining about a variety of systemic and operational deficiencies, and this is the biggest evidence to validate over 6+ years of the work I have been doing, over 13 years of the work Michael St. Martin has been doing, at least 6+ years that I know of, which Rick Kelly and the working group have been doing, and a couple of those, 2 or 3 of those individuals who are part of that group are here on this call. And what in many cases have been atrocities, thousands of errors in our medical records, over 160 deaths here at Coalinga. There's a book that's come out called Sex, Drugs, and Violence in Department of State Hospitals. Police have accused the former director, Pam Allen's administration, of being corrupt and evil. Police officers on CSHabuse.com have told me to go to the FBI. Doctors have told me if you keep digging deeper, they're going to try to hurt you. And what's really profound is that in 2013 and 2014, a police lieutenant named Andrew Berard, who can be heard on CSHabuse.com, telling me that Pam Allen put people in charge who were less than qualified, and we would not have many of the problems that we have if she had put people in charge. Now, Robin and Mike, I want you to understand that those recordings were made in 2013, 2014. Those people are now promoted into management. I'm going to give you a couple of examples. For example, Frances Hicks, the current clinical administrator, at that time was in charge of, for example, Unit 9. She was a program director. She's now like number 2 in charge of Coalinga. When you hear from these men who speak today, and from these 9 or 10 men who are going to tell you what they've observed of staff not wearing their masks, okay, it goes back 6 years, okay? And so I understand today that we're only going to hear about this corona thing. But you're going to ask yourself, how did this happen? It's not the staff. It's the management who did not help these staff understand the gravity of this virus. As you're aware, as reported in the USA Today last week, I think it was last week on a Monday, there's thousands of patients in the federal prison system that have been exposed to this virus. Thousands. As you're aware, Cook County Jail, 300 cases. It's in CDCR, the California Department of State Hospitals. We are so lucky that the Department of State Hospitals does not currently have a case of this virus, and they're walking around here like it doesn't exist, like it does not exist. And so the dots connect. And when Pam Holland went in front of the Senate Rules Committee, Senator Mitchell, and these recordings of the police that I referred to were made 1 year before Stephanie Clendenin and Pam Holland went in front of Senator Mitchell and Robin McDowell. I want all of you to know that Robin McDowell contacted Senator Mitchell, and I spoke to Senator Mitchell and asked them to be on this call today. And do you know what they said? They said that this was a district issue, that they would not be on the call, and that the head of the health committee would not be on this call. And this is alarming because nobody's telling these staff about the importance of wearing these masks. And as we said before we started to record, and I'm gonna turn to you guys in a second, is that these staff don't realize the danger that they're not only placing themselves in, but the families that love them. When they go home and they kiss their wife or they put their child to bed and kiss them on the forehead. And I've talked to officers, I've chastised. They don't. When they sit next to another staff member here at work and take their mask off, they don't know where that staff member was last night or who that staff member slept with, and they're violating the governor's order. But without regard, our first presenter is going to be Sam, who's on the hook, and our last presenter is going to be talking about the legalities and responsibilities of the police that run this hospital and run every hospital in California. And the chief of enforcement is David Starnes, and he was invited to be on this call today so that when this call ended, he could move into action and have his officers go around and do the right thing. And he chose not to be on this call. Okay, and my calling records reflect that I called him, and we are very alarmed about this. So I'm going to turn it over to you guys in a second, but we all care about our staff, and I want you guys to be proud that you're on this call, and I thank Robin and Mike for being here. And when you guys get off this call, Mike and Robin, I'm asking you to please, if you don't do a story, make a call and say, what is going on out there? Because we're in danger. Our first presenter is going to be Sam. Sam, I'm giving you 3 minutes because you're on a hunger strike. Everybody else gets 2. Sam has a prepared statement. Sam, it's all yours. And then you guys are going to make your presentations, and then Robin and Mike. But Mike and Robin, if you have any questions, please speak up. You guys are our guests, and if you want to change the plan, if you have a question, just tell me to shut up and ask your question. Go ahead, Sam. You got 3 minutes.
1, 2, 3, 4 is here.
Sam?
My name is Sam, and I'm currently housed on Unit 6 of Coalinga State Hospital, where several staff members are not complying with the governor's order that all essential workers wear face masks at all times while at work. And that's just one of the reasons why I do not feel safe here from the COVID-19 virus. This is the 10th day of my hunger strike without any food or heart medications for my serious heart condition. I felt compelled to begin this very dangerous hunger strike last week after Brandon Price and Dr. Withrow retaliated against me for blowing the whistle on them to licensing for allowing a patient who had no medical issues whatsoever to be housed on MA1. He never should have been there in the medical department in the first place. And he remained there for 2 years and abused other patients during that time. All staff and patients in MA1 and MA2 know I did the right thing by exposing that abuse. Yet I ended up being transferred from where I felt completely safe medically and where I could easily quarantine myself on a moment's notice once any COVID-19 cases arrived here. And they had me sent to where I do not feel safe medically. I fully intend to continue this hunger strike despite my constant chest pains until I'm returned to MA2 number 355 and be able to feel safe once again. It should also be noted that Dr. Hamrick and Brandon Price both misled the San Diego Public Defender's attorneys into believing that COVID-19 patients were going to be housed in MA1 and MA2 when they knew damn well that Unit 5, right next door to Unit 6, has been emptied and is a unit designated for all future COVID-19 patients. They misled the attorneys on purpose in order to support their false reasons for my illegal transfer to where I will never feel safe during this pandemic. And I also want to add one thing. I've asked several officers why they weren't wearing masks, and they all told me the same thing. We are law enforcement, and we are exempt. Those were their words, exact words. That's it. Thank you very much.
Sam, I want to make one point. You're on what's called a one-to-one, correct?
That's correct.
And you have a staff member sitting with you 24 hours a day monitoring your hunger strike and that you're refusing medication, correct?
That's correct.
Okay. Thank you very much. Our next presenter will be number 2386. Will you please speak?
Okay. Yes, I would just like to say that I have observed. First of all, there's two kinds of units in the hospital here, and Jeff can tell you what they are. I live on an ICF, which means there's more staff than on some of the other units. And 9 times out of 10, when the staff do come out of the office, they do have their mask on. There's are rare occasions that they don't, and somebody will say something, they'll put it on. But observing them in the office, sitting right next to each other, sometimes only a foot away, when they're in the office, they take their masks off. So, and like, I don't know where half these people live, and the thing is, they could not just be infecting themselves, but on the rare occasion that they do come out and they're not wearing their masks, it does expose everybody. I really don't know what else to say other than I observe them most of the time in the office when they're amongst themselves, not wearing masks. I guess that's really all I have to say on that subject.
Hey, Jeff, it's Robin. Can we? Can everyone also please tell me? Are any of the patients? Are any of you all wearing masks? Have they given you masks?
Robin, your audio. Could you speak up because we're all recording this? Your audio is a little low. Any way you could come a little closer to the microphone?
I just wondered if
you were asking if we're all wearing masks. I can answer that question.
This is 1550. I currently wear a mask as much as possible, and I do try and get all the social distancing that I can acquire in such confined quarters. But what really concerns me is they have these surgical masks that they give to us, but they want to tear the metal strip off of it, which conforms the mask to your face, which takes away from the integrity of the mask. And I feel I've turned down several of those masks that were offered to me because they were altered. And there's no reason for the altering of that I can see. And nobody has ascertained to me who is authorizing the destruction of these masks before they're provided.
Let me interject, Robin. There is a memorandum that came out November 23rd from Brandon Price, the director of Coalinga, that they are in the process of making cloth masks for all the patients. If we could defer that question until the end of our presenters, that raises a whole number of issues because the cloth masks that they're making do not protect us from the virus or staff who are not wearing masks. So I can address that issue at the end. That's a whole conundrum there in terms of if the staff aren't wearing the masks and also patients who are not even being indoctrinated to wear them or the importance of wearing them. Many patients have said, I'm not going to wear them for things, and incentivizing patients. And I've tried to check with some of the other hospitals yesterday. I was talking to Jonette Venegas, the public records information officer for the whole department, and could not get an answer. So if you want, we can address that at the end of the presentations. Robin?
Yep, that's fine.
Okay. Our next presenter, 7335, would you like to speak?
I sure would. I can reinforce a lot of what's been said. When Jeff informed me about
Can you report what's happening on your unit, please? 2 minutes.
I'm not supposed to give my unit, remember?
No, not your unit specifically, but report what you've observed on your unit with staff not wearing their masks.
That's what I'm talking about.
Go ahead. Thank you.
I said, after I got your call from Jeff, I started keeping a tally here of people that I did not see wearing a mask. Now, the level of care staff in our unit has been pretty good as a whole in wearing their mask, even when they're in the office, with a couple of exceptions. I only found maybe 4 or 5 times since Wednesday. However, I gave up after 15 to 20 times observing the hospital police neglecting to wear their masks. They evidently feel that they're immune from this order. They sit in their office, and whenever they get in the office, they take off the mask, with a couple of exceptions, and sit with almost shoulder to shoulder in front of their computers the entire time. So I'm concerned about everybody here, and including the staff, because those hospital police officers are not safe. There's another point I want to make just briefly. If Robin wants to find out about retaliation, she should talk to me, because I tried to push one particular COVID-19 safety how shall I put it, policy, and I was threatened because I kept pushing it. So if she wants to talk to me about it, I'll be glad to talk to her.
I will give her your identity and your information after the call in an email. Everybody's names will be given to her and Mike.
Right.
Is that all?
I'll be very happy.
Anything else you'd like to say?
I went through a lot of effort, and all I got for it was threats. So thank you for your time, Robin.
Okay. Number 2626, would you like to speak? 2626?
2626, speaking. Okay. I'm on a unit that's hearing impaired. Being hearing impaired, a lot of the patients, well, I should start with this. A lot of the staff don't know sign language. So in order to communicate, they're pulling down their face mask in order to communicate with the patients here on my unit. Not every patient's hearing impaired, but I'm going to say a percentage of them, let's just say 40%. So the masks come down when they need to communicate with those patients. We also have a problem with social distancing. Some patients, and including staff, don't want to use the 6-foot rule, even though we have tape on the floor. You're standing in line to pick up your meals 3 times a day, and you got the guy right behind you, standing in line just as if it was a regular line, even though you're pointing out that there's tape on the ground and there's a sign, and they just don't care. The same kind of people that don't wash their hands before or after the bathrooms or anything. They don't even take showers. We have a few guys on my unit like that. As far as the staff, for the most part, when they're out of the office, the nursing stations, they're wearing their mask, except for when they have to talk to the patients to communicate. otherwise they wouldn't be able to get any communication done at all. They just don't know the sign language, so it's hard for them to communicate. So they have to pull down their mask. And then the other problem we have, of course, with the DPS, which is the hospital police coming on the unit, they're never wearing their mask, and all staff pretty much in the office, the nursing stations, are wearing no mask, and that's 2626 report.
Wow. You know what? I just learned something. I had no idea about this deaf issue and that communication. We'll address that later, but I'm stunned. I just learned something. I had no idea. Thank you very much. Number 3877, would you like to speak?
Yeah, I'm a heart patient, and that puts me in a high-risk category. So I have those concerns. I'm 57 years old. On my unit, our staff wear masks for the most part, but my concerns extend beyond our unit. We go to the clinic, and when we have appointments in the clinic, they jam-pack an enormous amount of patients in a small area. There's a lot of what's called MDOs, which are mentally disordered offenders, that come to the clinic to draw labs. They monitor their medication by drawing blood for labs. The patients a lot of times are not provided masks. A lot of times when I request a mask, they tell us that policy says that we're not allowed to have masks because there is a policy that says we're not allowed to cover our face because that allows us to conceal our identity. And they use that policy, which is the same policy that they use to say we can't have like Halloween masks and those kind of things, to prevent us from being provided like the medical mask. And that's caused us to be denied masks when we go off unit a lot of times. The air in the hospital is 80% recycled air. They've cleared out Unit 5, which they say they're going to use in case that we get a positive case. That unit is right next to Unit 6, which is where they put the elderly patients. If we get a positive case in the hospital and they put the person in Unit 5, it being an airborne disease, it will go through the hospital rapidly. And honestly, I'm terrified. I have a daughter in the community that if it comes in here, I'll never get to see.
Oh, this is amazing, this call.
And the staff, we have some staff here that really care about us. Some of the staff are scared as well because some of the staff believe that they're not being tested properly. They don't know if they're asymptomatic. Some of them have actually said, I could be carrying this stuff in here and not even know it. And some of them have said, I could carry this in here. And one staff member made the remark and said that they're afraid that someone's going to carry it in here the same as that it's came into some of the rest homes, and it could wipe this place out. I'm terrified. And I live in a place where we have psychologists and social workers on every single unit, and nobody goes around to see if the people in this hospital, how they're coping with it, how they're dealing with it mentally. The administration doesn't care about how people are handling this mentally. They sit in their little offices out there, safe from the rest of the world in here, and they really don't care. Thank you.
Thank you very much for your emotional and compelling presentation. Again, I want to address what Robin brought up earlier. There is a memo that came out April 23rd, that they are in the process of making cloth masks. That's a conundrum issue, which we'll address at the end of the presentations. Thank you so much, sir. Okay. Thank you. 1515, would you please speak?
Yeah, this is 1515.
Your audio is a little low. If you could come a little closer to the phone, we'd like better audio on you since we're recording.
This is 1515. I'm highly concerned with the way the COVID policies have been erected in the hospital since the worldwide epidemic started. My major concern is we probably have about 30% of all staff that do not wear masks. I brought it to the attention at a unit meeting, and plus I brought it to the attention of the unit supervisor that when the staff come into our rooms to search, they do not change their gloves in between each search. Like if they grab a pair of shoes in my room, then they go and touch somebody's food in another room. They don't wear masks at the time they come in to do these searches. And that's probably about 40% of the staff that come in and do the room searches. Since the indoctrination of the coronavirus, they have fired all the janitors who are allowed to use bleach or any other chemicals that can actually clean or curtail this disease. They have taken away our alcohol pads that they kept on the tables so that we could disinfect the phones when we were going to use the telephones, etc., the tables. And I mean, so to me, you know, we're running out of soap, we're running out of toilet paper, we're running out of paper towels. I personally use paper towels when I open the door. Every time I open the door, that way it keeps a little bit of the distance because I don't have alcohol in which to wipe my doorknobs or anything like that. I used to be able to just go and get my alcohol pads, wipe down my room, and keep everything sanitized. But since the COVID breakout, they've curtailed that to the maximum capacity. Thank you.
Well, that's another profound presentation. We have only one last. Is 1, 2, 3, 4. Have you shown up?
Yes, I did.
Okay, so we only have 2 more presenters. You will be our second to last. I'm glad you've come. So you have 2 minutes, sir. Please speak.
Talk about me right now?
Yeah, 1, 2, 3, 4. Go ahead.
Okay. I can definitely verify that the staff in this hospital are not wearing masks, specifically on my unit. In fact, I just went to the office right now just to confirm, and there is only 2 staff out of 8 staff not wearing masks on the unit. We've had to ask staff in the med room to wear gloves when they pass out our meds. There are staff that refuse to wear gloves when they're dispensing our meds. The problem that I have is that when I go out to medical, to an appointment, I see like 7 to 8 DPS officers in a small cubicle all crowding each other in with no mask on. Okay, social distancing, I believe, is 6 feet. But I need to say this. I did write a complaint concerning this. Okay, on Saturday, April 18, 2020, when I was watching the NBC News at 7 o'clock a.m., it was made clear that all citizens are required to wear face masks, especially in situations where you have a hard time social distancing. That's a fact in this hospital right now. When I went to the office to request a face mask, I was told that by one of the staff members that they are not allowed to give patients any face masks anymore. When I asked him why, he informed me these were the instructions he was given. I then told him I have every right to protect myself as well as all of you. He told me there was nothing he can do. I asked him again, how come I and other patients can't have a face mask? Now he informs me the hospital is short on masks. I immediately informed him that this is not our problem and the hospital should have ordered more. I then informed him I was going to contact license certification. The problem that I'm having with this is that when I asked him who up in administration is denying us masks, he refused to give me the name of the individual that's passing this information down.
On my unit, they will not give a patient a face mask at all. Okay, and that's really concerning. I am at a high risk. I have cardiac. I have cardiac disease. I have a stent in my heart, and I'm a diabetic. So I'm at high risk too to contract any of this stuff. So it's a concern that really needs to be looked at very seriously and not just blown over by anybody, because really some of these staff in here, they're youngsters. They really think they're above the law. They really think that they can do what they want in here to us and just get away with us, because that's the way the administration acts in here. They just let them do what they want, and they never get reprimanded for any of their actions in here when we bring it to their attention. So that's pretty much all I have to say. Thank you very much.
Thank you, sir. Our last presenter is number 5050. Go ahead, sir.
Okay. 5050 here. One of the things is, within the hospital here, the people who are going to be bringing in the COVID-19 virus are going to be the staff. So that's where we need to protect, at least until somebody like patients in here contract the disease. That's where the protection needs to be. However, because the staff coming from different communities, cities and towns and even counties, that's what's going to happen. They talk about the staff not wearing their mask while they're within, it's called the nurses station. It's the observation room for the units. What they do is they huddle on one side. They do not wear masks. They do not wear gloves there. And it's right where the computers are so they can watch what each other's doing and socializing. That's where it's going to be transferring from staff and then work its way to the patients. Also, the staff are there when we receive our food. I personally self-isolate in my room almost the entire day. That way I avoid dealing with the staff. However, since I'm indigent, I have very little money, so I have to go to the day room to get my meals. However, when you have staff that are not wearing gloves, when you have staff that are not wearing face masks and they're passing the food to you, that's where I'm going to catch it. And in the one case, there was a shift lead. I went to the supervisor of them 2 times before that staff member actually wears a face mask now. So also when the staff are over there being side by side, usually less than a foot from each other, they're using the same keyboard, they're using the same mouse on the computer, they're using the same phone, and they're not disinfecting. This is the social distancing supposed to happen, especially anything you're touching. That's where it's going to get us the most. Because of the droplet part, what they refer to as the droplet precautions. This is because when you breathe it, when you sneeze, when you cough or something, it goes there. The staff will pull down their mask, having their fingers inside of the mask right where their droplets are, when they so they can put on their mask or take it off just before they answer the door or touch whatever they're going to work with. So this is a problem that we have. The other thing is Department of Police Services, which is DPS. Jeff had mentioned about David Stars, who is the chief law enforcement for Department of State Hospitals. He's called him, he's left messages, everything else, trying to get some assistance, begging for assistance. However, he doesn't do anything and he doesn't return his phone calls or messages or anything else. DPS, according to their policy, they are supposed to enforce the orders from the state, supposed to enforce the laws of the land. How do you do it when the DPS are not wearing the face mask? They're supposed to be the same as the police on the street. They're supposed to be the ones monitoring the staff, and whether they have to write a ticket or whatever, given by the county or given by the state, they are supposed to do that. I think it really kind of sums things up. I have the ability to see the flags that are outside of the administration building, and I do find it really interesting that Department of State Hospitals Coalinga has only flown the U.S. flag on his flagpole for more than 2 weeks now. If you go with the symbolization of that, it means that that particular building does not recognize or represent the state of California, only the federal government. I find that very alarming. And since we had talked about with licensing and patients' rights, when complaints have been sent to them, we get the response back saying, per the governor, we are not investigating anything. It's going to be 6 months before we can look into any complaints, even if it involves the staff not doing the protections. Thank you.
Thank you. Robin and Mike, it's all yours.
Hey, thanks, Jeff. Hey, thanks to everyone for coming together like this. I thought this was really
let me say one thing, Mike, before I do. We have 1,200 patients here plus. I couldn't get an exact number Friday. Over 2,000 staff. We've had, I believe, 10 patients. They're on 50-man units. So these guys are representative of like 500 patients total. So go ahead.
Okay. Well, look, like I say, I just want to thank everyone for speaking to us. I do have a couple of questions. The police there, are they employees of the Department of Hospitals, or do they come from outside? Okay.
Yes.
So they're department employees. Okay.
The Department of State Hospitals, they are employees.
This is 7335. I found out something recently from one of the officers. They were formerly under the aegis of Brandon Price, the director of State Hospital. I found out now they are independent of Brandon. They have their own unit in Sacramento and their own organization per se. And as the officer told me, he says, we do not have to listen to Brandon Price. If that gives you any information.
Well, thank you for that. Okay, thank you. I want to tell you that my understanding from what you guys have said, and correct me if I'm wrong, is that the clinicians and the police, they all have masks. They just don't wear them. Is that correct?
They don't wear them consistently.
Okay, all right. And it's a little unclear to me. Do you guys have masks or not?
Well, let me address that, Mike. So there's a memo that came out. I posted on StephanieClinton.com. I've been pushing the issue. A memo came out. Let me read it to you exactly what it says. Let me grab that. It came out the 23rd that they're in the process of making masks. I'll read you verbatim what it says. Not all the units have copies of it. That's typical around here. So this is what it says. It says masks for patients. We are in the process of manufacturing cloth masks for the patient population. We are also developing a protocol for distribution and laundering of the masks. MA1, MA2, and TU6 will be the first units to receive the masks. A distribution schedule for all remaining units will be published next week. It's signed by Brandon Price, Executive Director, DSH-Coalinga. And
okay. All right. I appreciate that.
This is 1550. In regards to your question about do you wear a mask, on my unit, I have approximately 4 people that wear them on a continual basis. And then there's selected individuals that, like the ones that pass out the trays, who some wear masks and some do not. They do allow masks to be passed out on my unit. I'm on RRU, but they only allow one a day, and sometimes you can't even get that. I asked for one a day and was refused. Now, during a room search the other day, they said 6 masks, and they said the hospital is short of these masks, so give me 3 of those so I can discard them in the trash. And to me, that makes no sense.
Yeah, I understand. So
this is 1, 2, 3, 4. Just real quick on my unit, which has 50 patients, we are not allowed to have any mask at all.
Yeah, Mike. What you'll find is that with this department, again, hopefully we'll talk after the call. This goes back 6 years. This department is out of control. The lack of consistency, and these guys, the working group, as I introduced in the beginning. If we work together, what I will show you through recordings and emails, there's no consistency in medical care, medical records. The whole department from state hospital is out of control, Mike.
Yeah. Okay, so have any staff there been tested positive?
Not that I'm aware of.
Okay, great, thanks. That's all the
you have to realize they will not tell us whether that's the case or not.
Yeah,
they won't tell us
never
how many
reveal that.
have been turned away.
Yeah, exactly.
Okay. Well, thanks. That's all my questions. Thanks.
Robin?
I guess I would like a little clarification, if possible, on the alcohol for cleaning the phones. What?
Oh, let me point something out, you guys. I want to ask this. You know, we get out every hour. Has anybody seen any cleaning going on between the release of the units every hour of the grill area?
No. In the beginning of the lockdown, yes, but after the major unit lockdown to where they started doing releases, then that's a no.
Okay, so Mike and Robin, so we're getting out. 1,200 patients are being released every hour to go to the canteen and grill and pick up packages. And what I want to suggest that needs to happen immediately, so in addition to the mask wearing that needs to happen right after this call, and by the way, I'm going to give you guys the dial-in to listen to this conference. It needs to be shared with everybody. The police need to move immediately. But I'm calling for, they're releasing 1,200 patients every hour, 50 at a time, to go to these common areas. I want to see cleaning crews out there, you know, in PPE, cleaning all these surfaces.
Let's go back for a minute. It's not 1,200 patients an hour. It's 50 patients
50
an hour.
50 every
right,
hour.
Right, not 1,200.
Right, no, I misspoke. Right, you're correct. So 50 patients every hour, you know, and I think some of the patients are not working. They've been taken out of their jobs. So we need to have crews out there up and down the hallways, you know, continually clean these surfaces, and you know, that's what I'm calling for, and I assume you guys will support that. And that way these guys can keep their jobs.
7335. If you want to give me a call about the phone business, I can give you the whole rundown about what happened, as I mentioned before.
Right. Some units will give you these handy wipes with alcohol to wipe them down. You got to go to the office, take the phone. That's what's happening with that, Robin.
This is 2386. I'd like to interject something if I could. Okay. They have three different kind of little plastic bottled handy wipes. One is peroxide, one is Clorox bleach, and one is like I guess it's like the alcohol pads and stuff. Okay. Well, you can't make any alcohol out of any of these. Okay. I understand that they have to keep some of them, like the Clorox and the peroxide. They need to keep those, but you know the other ones, they can leave them out in the day room, especially on ICFs where they're supposed to have a staff out in the day room at all time, so they can be monitored. Now, they tell us that we can always go to the office and get them, but, you know, most people get tired of having to knock on the door every 5-10 minutes just to get a handy wipe or to wipe off the phone or to go wipe off the water spout or something.
And the staff are not responsive.
And they're really not, you know, and this is where, you know, some units are allowed to do it and some aren't. But the thing is, you know, we're under a state of emergency, which means Title IX and Title 22 and all that other stuff is all suspended, all the ADs and all the little policies, so they can use their own discretion. And I know as a fact, you mentioned Michael St. Martin, I know as a fact that he has called up there numerous times and said, just leave them out in the day room. People will use them. And like on units that haven't had a problem with that, then they're creating a problem or a what-if problem. And also another person called up and had mentioned about patients' rights and the licensing. Okay, like right now, all that is even suspended. We have absolutely no recourse to take our complaints or concerns to anybody because they're all suspended. So having you guys listen to us, which thank you very much for listening, is our only recourse. We have no other recourse. Okay, thank you.
Yeah.
This is 1515. Yeah, I mentioned the other day at the unit meeting about the staff not walking around because they're required to go around and do doorknobs and stuff like that and wipe and clean because the site technicians, they're under the impression that they're actually police, but they're actually called LOC, which is level of care staff, and it is their responsibility to maintain the cleanliness. And I'm highly concerned because, like I say, I used to be a janitor up until the time the COVID virus hit this hospital, and they laid me off and said the only people that need to work are the ones that are going to pass out the food on the units. And the regular IT workers that work on the units themselves, all of them are qualified to use bleach, They are not allowed to use bleach. They're not allowed to use Virex or any other cleaning agencies. The only thing they're allowed to use is blue Windex or yellow Windex.
Yeah.
And the sanitation and the germ-killing capacity of that is probably only about 40 to 50%.
Right.
And
Mike and Robin,
raises the concerns of if the coronavirus get in here,
Mike and Robin,
like wildfire.
Go ahead, Mike and Robin. You have generously given us 45 minutes of your time. I want to read off. You know, this is a dire emergency. And are you there, Mike and Robin?
Yeah, I'm right here. I'm going to have to take off, but
Robin?
I'm right here. Yeah.
Okay, so I would like, if you, unless you instruct me otherwise, I'd like to bring this to a close. We are desperate here. We are thankful for you being on this call. I want to bring this to a close by listing the names of the public health officials that I've contacted, so you know, so that I am on record.
Jeff, we have them because they're on your email. They're on your email. We have them.
Okay, but I want to read that onto this recording that's going to be posted on StephanieClinton.com.
I have to go. My phone's going.
You guys can drop off if you want.
2386. I have to go. My phone's breaking up.
Mike and Robin?
Yeah.
Mike?
Yeah, Jeff. Yeah.
There's people here that have been contacted that you're not aware of, who I've called. I personally don't know what to do at this particular moment, and I want to be on record with my deep concerns at this time for what to do. This is me to you guys right now on this call, because I don't know what to do. I don't know where to turn with these men's concerns. We got PAs going off a second here. Hold on just a minute. I haven't. I'm emotionally broken. I've been doing this for many years. So these people that I'm contacting, Mike, are acting like there's something wrong with me, like I'm crazy, like I'm not credible.
I understand.
Mike,
I understand, Jeff.
And I'm so grateful. And my only way of dealing with this is building websites, and still nobody's listening. And I know the coronavirus is front and center right now. But what I need these people to understand, Mike, after this call, is that this is a coronavirus issue, and we can circle back to the other stuff later. But I need to call these people after we get off this call and email them and tell them they better listen to this call. They better listen to these men. Go ahead, Mike.
I just think that sounds like a good idea.
So let me read this off real quickly. It's going to take me a couple minutes. Would you indulge me?
Well,
for a moment?
It's a very long list. I know.
No, it's going to take me like 3 or 4 minutes. So David Starnes, Chief of Law Enforcement, State Hospitals. Lisa Tillman, Deputy Attorney General. Sonia Angel, Director of California Department of Public Health. Heidi Steneker, Deputy Director of California Public Health. Rumia Segala, State Hospital Facilities. Colleen Whitham, State Facilities, California Public Health. Edwin Hoffmark, Unit 14 Treatment Team. State Senator Holly Mitchell sits on the Health Committee. Senator Anna Caballero, she's in charge of this district. We voted for her. Wouldn't even take my call yesterday. It says we're not interested. Okay? Senator Richard Pan, Chair of the Health Committee yesterday. Shannon Villegas, I spoke to her personally. Called her again today, an hour before the call. Sent her email. I actually forwarded her a copy of your email 2 hours before the call to let her know the urgency. No response. Vice Chair of the Health Committee and the Senate Rules Committee. I spoke to Chelsea Schilling yesterday. Okay? We're not interested. Okay? Dr. Joaquin Arambla, he's a doctor, has for 6 years has ignored me. His Chief of Staff, Hans Hemmen, has told me for years nothing's wrong at Coalinga. Dr. Shirley Weber, Assembly member, worked with her legislative director for 2 years. 68 patients from San Diego. Has said that this is a district issue. Chief Deputy Public Defender Angela Bartosic, who is the supervisor of the attorneys for Mr. Consiglio, who's on the hunger strike, okay, sent me an email a few weeks ago saying that we monitor the patients.
Yes, I'm going to have to go
our patients at Coalinga. Okay. Jeremiah Wanberger, Senate Sergeant, has been over 50 hours on the phone with me. Rosamine Galvin of Grunfield, I'm almost done. Jim Spurtis, our former class action attorneys, were on the conference call 2 years ago, posted on CSHabuse.com. 13 years, class action attorneys have been made aware of the situation, are not on this call, have ignored these men's cry for help. Lieutenant Chuck Rabeau at the Huron Police Department, I called him today. I told him there's hundreds of people's lives are in danger. Not only here, Mike, but several other hospitals right now. This is going on, not only here right now, but at several other hospitals, Mike, today.
Jeff, I understand. I gotta go, Jeff, okay?
Okay, buddy.
Go, but thanks for putting this together.
Okay.
Bye, Jeff. I'm hanging up, too. Thank you.
Robin?
Yeah, thank you very much. I'm going to hang up, too, but thank you. That was very helpful.
Okay, Robin. Bye-bye.
All right. Talk to you later.
Who else is on? This is Sam.
Joe,